Vaccines are an important part of keeping children healthy. You may have questions about vaccines if you're a new parent or caregiver. CCI can help. Here are the answers to some of the most common vaccine questions we hear in our health centers.
Yes, vaccines are very safe. Millions of children receive vaccines every year without complications. In fact, you probably received a vaccine yourself when you were a child, or if you came to the United States as an adult. The United States has one of the best vaccine safety programs in the world. You can feel comfortable with your child receiving a vaccine.
Vaccines protect infants, children, and adults from disease. Diseases like measles and whooping cough can be serious to children without a vaccine. Children with a vaccine have a lower risk of illness from these diseases and many more.
Some vaccines may cause mild side effects, such as redness or swelling in the area where the child received the injection. These side effects usually clear within a few days. Serious side effects after a vaccine are very rare. It is important to remember that the benefits of vaccines are much greater than any mild side effects.
Children receive vaccines at a young age because they are more at risk of exposure to disease than adolescents or adults. Vaccines protect infants and children at a time when they are most vulnerable.
Your child would need more than one dose of some vaccines to help them build disease resistance. They may also need more than one dose to stay safe from diseases that change over time, like the flu. Each vaccine dose provides your child with the best protection possible.
Young children are at an age where they are at a higher risk of exposure to disease. These diseases may lead to hospital visits or even death. You leave your child vulnerable to disease if you delay or spread out vaccines. For example, diseases like pneumococcus usually occur in the first 2 years of life, while diseases like hepatitis B are much more serious for children than adults.
No, studies continue to show there is no relationship between vaccines and autism.
Babies can safely receive several vaccines at once. A healthy immune system stops thousands of germs every day. An antigen is the part of the germ that helps the immune system build antibodies which prevent disease. Antigens in vaccines do come from germs, but the germs are so weak that they do not cause serious illness. Babies encounter fewer antigens in their vaccines than they do in their everyday environments. Vaccines will give your child the antibodies they need to stop disease.
Some of the vaccines we receive as children wear off with time. Adolescents need regular vaccines to ensure they have protection before the exposure risk increases.
Children can usually receive a vaccine if they have a mild illness like a cold or earache. However, you should speak with your care team before your appointment to let them know about any illness.
Yes, newborn babies are at a very high risk of disease. Breast milk provides nutrients that help them fight some infections as their immune system develops. However, breast milk does not protect children from every disease. Your baby needs a protection that can only come from the vaccine schedule recommended by the CDC.
No, young children at home can still catch diseases that are preventable with a vaccine. For example, children are at risk for exposure in public spaces like playgrounds, grocery stores, or even from friends and family who visit the home. You should not wait to vaccinate your baby.
Vaccines are an important part of a healthy and safe community for everyone. We want you to feel comfortable with your children receiving the vaccines they need to live well and safe. Please contact your CCI care team with any questions. We are here to help you.